Metapneumovirus outbreak in China 2025. 5 years after the COVID-19 pandemic, a new outbreak has occurred in China, this time with human metapneumovirus, HMPV. The disease is usually mild, but in weakened patients it can develop into pneumonia and lead to death. Beijing assures that nothing terrible is happening, but videos and photos of overcrowded hospitals are spreading on social media. In addition to China, Kazakhstan has already reported cases of infection. 30 cases have been identified there. An outbreak of human metapneumovirus HMPV has occurred in China, the China Disease Control and Prevention Administration reported. Respiratory samples taken from hospitals between December 23 and 29 tested positive for influenza virus, human metapneumovirus HMPV and rhinovirus. HMPV cases are on the rise in China among children aged 14 and younger, with the disease most prevalent in northern provinces. According to the Daily Star, the virus has already put a significant strain on the local healthcare system, with videos and photos of hospitals overflowing with sick children circulating on social media. The pathogen causes symptoms similar to COVID-19 and the flu, attacking the lungs. The World Health Organization and Chinese authorities have not yet officially declared a state of emergency. The independent newspaper writes that Beijing is downplaying the scale of the problem. Chinese Foreign Ministry spokeswoman Mao Ning said that viruses often spread during the winter season and this is a normal occurrence. I can assure you that the Chinese government cares about the health of Chinese citizens and foreigners coming to China, Mao said, adding that traveling in China is safe. The outbreak occurred 5 years after the world first learned of the emergence of a new coronavirus in Wuhan, which later developed into a global pandemic. Not only in China. Following China, Kazakhstan announced cases of metapneumovirus infection. 30 cases have been identified there since October 1, 2024, the republic's Ministry of Health reported. Human metapneumovirus is one of the classic viruses that has been circulating in many countries for decades, the department said in a statement. At the same time, the increase in the incidence of metapneumovirus was only 1.6%. The Kazakh Ministry of Health explained that the pathogen is transmitted mainly by airborne droplets, and to a lesser extent by contact and household contact. The main symptoms include cough, runny nose, shortness of breath, fever, headache. While there is no specific treatment for the infection, symptomatic treatment is used. In addition, an increase in the number of positive tests for the virus was reported in the UK. There, HMPV was detected in 4.5% of all tested patients. In Russia, they said that they are monitoring the situation with metapneumovirus in China. According to a statement from Rospotrebnadzor, a set of RV-screen reagents for rapid diagnosis of the disease is available in Russia. Since 2010, a set of RV-screen reagents developed at the Central Research Institute of Epidemiology of Rospotrebnadzor has been available. This modern kit is designed for the rapid and accurate diagnosis of respiratory viral infections, including metapneumovirus, the department assured. The authorities of Cambodia, located near China, also announced that they were monitoring the situation. The country issued warnings about HMPV, noting the similarity of the virus with COVID-19 and influenza. And in India, neighboring China, they noted that there is no reason to panic, since HMPV is similar to any other respiratory virus. What is HMPV? HMPV is a respiratory virus whose symptoms are similar to a cold and flu. The disease is usually mild, but in some cases it can lead to serious complications, such as pneumonia. Those at increased risk include children under 5 years of age, especially infants, older adults, especially those over 65, and people with weakened immune systems or chronic respiratory diseases such as asthma or chronic obstructive pulmonary disease (COPD). First identified in 2001, HMPV is a single-stranded RNA virus that spreads through the air or through contact with contaminated surfaces. The incubation period of the virus is 3 to 5 days. Preventive measures include wearing masks, frequent hand washing, and strengthening the immune system. In 2023, cases of HMPV infection were reported in the Netherlands, the United Kingdom, Finland, Australia, Canada, the United States, and China. Symptoms of metapneumovirus. Chulinov recalled that symptoms of metapneumovirus infection include typical manifestations of acute respiratory viral infections, cough, nasal congestion, runny nose, fever, shortness of breath, hoarseness. According to Rospotrobnadzor, metapneumovirus affects people of all age groups, but mainly children under 5 years of age are affected, and most often metapneumovirus infection is suffered by children in their first year of life. According to Vladimir Chulinov, severe course of metapneumovirus threatens primarily children under 5 years of age and the elderly. In healthy adults, the virus causes mild acute respiratory infections. Severe and moderate forms of diseases caused by HMPV occur mainly in children in their first years of life, in the elderly, and in patients with immunodeficiency. The most common symptoms are cough, runny nose, shortness of breath, fever, headache. 19.0% of patients with metapneumovirus infection experience symptoms of intestinal dysfunction, vomiting, loose stools up to 7 times a day, the department said. Prevention of metapneumovirus. Preventive measures that have been familiar since the pandemic will help protect against metapneumovirus. It is recommended, regularly and thoroughly wash your hands with soap, especially after visiting public places, as well as before eating. Avoid close contact with people who have symptoms of respiratory infections. Regularly clean and disinfect surfaces at home and in the workplace. Do not touch your face with dirty hands. Regularly ventilate the premises. If you have symptoms of RV, you should follow the rules of cough etiquette, wear medical masks and change them every 4 hours, stay at home and consult a doctor as soon as possible. Epidemiologist, Deputy President of the Russian Academy of Education, Academician of the Russian Academy of Sciences Gennady Onishchenko said that metapneumovirus can already spread unnoticed in Russia, since many Russians went on trips during the January holidays, including to China. The expert advised Russians not to hide their trips to China, but to honestly tell the doctor if they have to go to the hospital with symptoms similar to RV. According to him, all Russians who return from China should wear masks so as not to provoke an outbreak of the disease in Russia. The scale of the spread of metapneumovirus. Rospotrobnadzor specialists are monitoring the epidemiological situation in connection with the growing number of people infected with metapneumovirus in China. The agency is keeping the situation under control. At the same time, strains of the HMPV virus have already been recorded in Kazakhstan. More than 30 cases of metapneumovirus infection have been identified there since October 1, 2024. At the end of December, the Taiwanese publication Money Uden wrote that the mortality rate caused by metapneumovirus reaches 43%. Unlike COVID-19, which has reagents for rapid screening, there are very few reagents for testing for the human metapneumonia virus, the portal noted. In addition, there are currently no antiviral drugs for the treatment of this virus. Only supportive therapy can be prescribed for the disease.